Switching gears a little bit. So we did not too long ago a family impact and well-being survey, and 31 people filled this out for us, and I am here to present the findings. Okay, so why did we ask you all to do this survey? We we have literature about, very few patients, and we have the science and we have all of that information, the gene and all of that. But what we don't have is family's experience and, the mom sitting in the waiting room and the schedule of all the appointments and all of that. We don't have any evidence of the impact it is having, and that's a huge gap. So we want to fill that. And so we asked everyone directly what we asked about the emotional load, the support system, the access to care, and financial impact. And who answered? That was 31 people. Like I said, 77% are parents, 81% are women, 3 have LCC, and were answering for themselves. So we also had 1 sibling, 1 adult child, 1 legal guardian, and 1 unrelated caregiver. I want to name up front, because this shapes everything that follows. This is the voice of mothers. It's a real voice and it's worth hearing, but it's not yet the voice of fathers or siblings or the adults living with LCC in their own bodies. When I show you a number today, that's who's behind it. Okay, so how we asked, we used a platform called RedCap through Children's National, Dr. Jamie Frazier. We recruited through the private LCC group that many of you are a part of, and our own contact registries. Exemption was determined, and we had just consent from anyone that filled this out, and no identifying information was collected. The one thing I need you to hold on to is every scale runs 0 to 10. Higher always means more of the named thing. So more stress, more support, more harm. So if you think of the scale, then that will help you with the results. So first we'll start with finding 1, the emotional load. And we found that it is extremely heavy. So on average, we had 6.9 out of 10 say that they are feeling overwhelmed or have emotional stress, and then feeling overwhelmed is 6.6. So numbers like that, let's put it a little differently. 3/4 of the people in the survey rated their emotional stress at 5 or more. So a quarter of them rated it at 8 or above, and 5 people rated it at 10, the maximum. The one thing that stopped me, the lowest score anybody gave, the single least stressed person in this entire sample, was a 3 out of 10. So not one person described life with LCC as unstressful. So whatever else we say today, we should be clear that distress here isn't some subgroup. It isn't the families who are struggling. It is the condition. Finding 2, families are holding each other up. So we asked, how supported do you feel by your family, by health professionals, by your community, your neighbor, your school, your church? Family support came in at 7.1 out of 10, the strongest number in the entire survey. Health professionals was a 6. Community was a 4.9. So the further you get from your your own family, the thinner the support seems to be. And the community number has something underneath it that is the average hides. So 6 people rated their community support at 1 or below. A quarter of this sample sits at 2.5 or below. Somebody put 0. There's a family out there who, when asked how supported they feel by their local area, their school, their faith community, said none. So family support never drops that far for that many people. What I want you to take from the slide is, because I think it's true, families are holding each other up because the systems around them are not holding them up. The resilience in this community is real. It's also load bearing, and it's carrying weight that shouldn't be on it. Finding three, the access to specialists. We asked how difficult it is to get to a specialist who knows LCC, a neurologist, a geneticist. The average was 4.1. Um, Sounds like a manageable inconvenience, but it isn't, and here's why. Three people said zero difficulty. Other people said 10, the maximum score on the scale. This this question had the widest spread of anything in the survey. So the average of 4 describes almost nobody. So what's actually happening in this community is split. Some families found a clinician who knows this disease, and then some families didn't. Same disease, same rarity, opposite experience. As far as I can tell, which side you land on, it has very little to do with how sick your child is. If it has more to do with geography and with luck. So to the researchers that are here, for those of you who do this work, the variance here isn't noise around the mean. The variance is the finding. Next one. So the economic toll is structural. So 13 people, about 42% said LCC caused no change to their employment, which means everyone else, roughly 58%, changed their working life because of this disease. 9 people reduced their hours, 2 took unpaid leave, 1 took paid leave, and 7 people quit their job entirely to care for their child with LCC. 7 out of 31. Average financial strain across the whole group, 6.1 out of 10. What that says to me is that caregiving for LCC doesn't sit alongside a career, it replaces one. And that's not a personal choice anyone in this room made freely. It's what happens when a progressive neurodegenerative disease meets a workday. 7 systems, 1 disease. We asked about insurance and how we pay for care in 7 different ways. We're spread across the world. 8 families are in a national health service. 8 have employer paid private insurance. 7 are on state insurance for low income and disabled individuals, which is Medicaid if you're in the United States. And 5 are under single payer. And then 2 families have no health insurance at all. They pay for every appointment, every scan, every medication out of their own pocket. For a progressive neurodegenerative disease with no cure, 1 more family is on self-pay private insurance. That's roughly 1 in 10 of this community absorbing the full cost of LCC alone. For anyone thinking about advocacy, this is why there's no single policy lever. Whatever we push for has to work in at least 4 health systems at one time. Okay, finding 6, the gap between strain and care. So this slide I find the hardest. I want to be careful about how I say this. Nearly 4 in 10 of you, so 12 people, have never sought any mental health support. Not a therapist, not a psychologist, not your general practitioner, or not a support group. In a group whose average emotional stress is 6.9 out of 10, 19 who did seek help mostly went to a licensed therapist or to their family doctor. But I want to flag this more as a question rather than an answer. We asked you to rate your stress. You said 6.9. Then we asked you to rate the harm it has done to your own mental health. You said 3.7. So we asked about your physical health, and that was 3.8. And not one person rated it above a 6. So heavy strain, moderate harm, those 2 things kind of sit oddly together. One reading is that this community is genuinely resilient and the strain isn't landing as damage. Another reading, and I say this gently because I think some of you will recognize yourselves, is that caregivers may not be fully registering what this is costing them. I can't tell you which, this survey can't. You need to follow people over time to answer that. But if there's a clinician in the room looking for a question we're studying, that's one I'd hand you. Every one of the 31 people answered one open question. What is the greatest challenge you or your family faces because of LCC? More than half of them, in one way or another, said the same thing: the unknown, not knowing what tomorrow brings. So I want to read you 3 answers in their own words. We don't know how much time LCC is going to give us with our son. It's hard not knowing what tomorrow, next month, or even next year will look like. Every doctor appointment is scary. It's very mentally draining. It impacts my job, my finances, my time, my mental health, my relationships, my physical health. I have lost one daughter already to the disease. It is like I am just waiting around for it to take my other child. And one more about what it takes just to get a diagnosis. If it wasn't for my wife demanding an MRI when my son was around 3, we may not have even gotten his diagnosis by this point. So, what this means to the clinicians: when a family comes to your clinic, ask the caregiver how they are doing, not as a courtesy at the end, but as part of the visit. Almost 4 in 10 of them have never been asked by anyone. And your own support score is at a 6 out of 10. That's the middle of the scale, not the ceiling. So there's room. To the researchers, family outcomes belong in the LCC literature alongside the imaging and the genotype. The variance in access to care is a research question and not a footnote. And the gap between reported stress and reported harm needs a longitudinal design to untangle. And to me, the foundation and all of us, community support is the weakest number in the survey. It is also, of everything on this slide, the one most within our reach. So we can't cure the disease yet. We can build peer connections. We can help families advocate at school. We can help somebody talk to their employer before they just quit their job. And for the 7 people who left work, financial navigation is something that we could be able to help with and have one time. But let's also talk about what the survey cannot tell us. 31 people in a large sample for LCC. It's a small sample for statistics. Everything I showed you today is descriptive, so no significance testing, no comparison between subgroups. We had no comparison groups, so I can't tell you whether LCC families have it harder than families facing other rare diseases. I genuinely don't know. This was at one point in time. So I showed you high stress sitting next to low care seeking. I cannot tell you that one causes the other. And we recruited through a private Facebook group and our own registries, which means the families we reached are the families already connected to this community. The ones who aren't, we didn't hear from at all. But what would come next is a bigger group across multiple sites, followed over time with a comparison group. And that is all I have for you. But if you have any questions, please ask. Was anybody shocked by any of those numbers? I'll ask you a question.
I was surprised by the community support number, and I'm wondering if there are family members that could help clarify that.
I'm not fully understanding what the.
Oh, yeah.
We
You just
missed
walked
a
in,
little bit.
Danielle. Sorry.
From what I understand, I think how community is not involved is that, so I feel like in our situation, we didn't stop talking about it. So I felt like our community was fully involved. Our local news station did a segment on him. And then with Josh being on the fire department is a big brotherhood. So every fire department stepped out and helped us. So I feel like our community was very involved, but maybe other communities are not involved because people aren't talking about it. I know everywhere I go, I hand out my LCC stickers to join the foundation's Facebook page, but maybe that clarifies things.
I can add to it too. I think it's the rarity of the disease, right? People were all pulled TikTok, Instagram, look at this, look at that, right? We have so many things bombarding us every single day, and people only have so much capacity to take that information in. Now I'm going to try and people say, oh, well, what does LCC stand for? And I'm like, okay, your listening ears are going to go off when I say leukoencephalopathy, right? And they just look at you, right? And so I think that's probably a big part of it is like, how do you get, why should they care? How do you get people hooked in? And I mean, I think if you see like a Ben, an Ekram, a Lucy, you know, an AJ, right? Like once you see their smile, that pulls people in. But if you're just standing talking to me or Ashley or Josh or Danielle, like it's hard.
I'll share a little bit of our experience. So I will preface with that we just got our diagnosis end of last year, like October, November. And whenever we met with our neurologist, he was like, oh, genetics came back and it indicated this. And I don't really know anything about it, so I'm going to send you to a geneticist. Otherwise, you could probably find something online. And so we are still waiting to see the geneticist. And it was just by chance that I stumbled across LCC Foundation whenever I just started like firing away at Google, trying to find everything I could online, like copy pasting things from my daughter's MRI report to Google to see what does this mean? Where am I going? I was so terrified and so lost and so am. And so it's just by chance that I filled out the contact form on the website and actually reached out and it just fell into place for us. But still, like I told my daughter's therapist, because she was diagnosed with cerebral palsy. So we were already in, occupational therapy, speech therapy, physical therapy. And I told them, we recently got this diagnosis. Like, do you know anything about it? She's like, I don't know about that. And I was like, well, it was based off her genetics. So I'm pretty sure that's what she has. And needs to say, we had one more appointment with that therapist and never returned. So in our community, we do lack support. I think it was just like, once I become more educated and get plugged in a little bit more, then my adequacy can like grow. But right now at this point, like we're still like running down a dark hallway.
I mean, when we were first diagnosed with Ekram, you know, we were very involved right away to start the grassroots and try to do fundraising. We went to talk to his school in a night that where all the parents were. I don't know, it was a school night return or something like that. And we were able to raise a lot of funds at that time. We had great support. We were actually on one of the news channels and they did a line for Ekram and there was zero return on that. We had like maybe a very little, I would say. I was expecting a little bit more return, but he was on the news and all that. I think the biggest thing is, we went around our community, our close circle, on and on and on, and the support shrinks and shrinks and shrinks. And then you feel like, am I asking too much? But you don't want to stop asking, but you come to a point that the responses gets smaller and smaller because there are a lot of kids out there, right? And a lot of conditions and everybody's seeking support. Even at my job, I get every week a couple support and donation requests. We try to respond, but again, sometimes it becomes just an email that you're receiving and request that you're getting. That's at least how I feel. And it is hard to push other than your close circle to get more support. And they don't also know what we go through.
Kelly mentioned this yesterday and she stepped out, so I definitely don't want to speak for her. But from the outside watching, you know, her and Lucy go through this, she's been in 2 different school systems in the last year. And I think the other grandmother Kim will chime in and say it's been 2 very different experiences. The school system that she was in to begin with, 10 minutes from where she is now, I think they thought that it was a lot of exaggeration and maybe just kind of overlooked it. The school system she's in now, her teachers have been very quick to educate themselves. They wanted to learn more. And I think that's what's made the world of difference in the education community is that you have one group of teachers that are like, tell me all about it. We want to know, Lucy. When we walk in the door, everyone from the custodian to the front office workers to the counselor, they're like, oh, hey, Lucy, and waving. And they know who she is. They know what she likes. It's very different. Even though she had been at the other school since she was 3, I think it was a slow progression. So they just kind of assumed they knew instead of taking the time for the education.
Absolutely. Yeah, that makes sense.
Being an LCC patient, everyone kind of overlooks me and thinks I'm fine. But having to explain to everyone that I am an LCC patient and part of the LCC Foundation on the board, that's kind of been our only community, and kind of it's like kind of saying what support, what um help do you have? It's like we are our own support team. Our family is our support, and the LCC Foundation has kind of given us support, but when you overlook all the education, it's I sort of had to explain to people that I do have this condition and it's not to be overlooked. That's all.
Yes, that's great. You're an amazing advocate, Alice. You do great work. Did anyone have any other questions or comments about the survey results? No? Okay.